So this is Greg McIntyre here with Kris Thompson, Peak Resources, and I'm the elder law guy. Thanks for joining us. We're going to talk a little bit about nursing home care today. So Kris, you were at a great nursing facility, and you were the executive director at Peak Resources in Shelby, North Carolina, correct?
That's correct.
All right. Please correct me if I butcher anything. Okay.
Right.
So you're the executive director, and what are your responsibilities over there?
Pretty much responsible for everything that goes on in the facility. Obviously, the financial part of it and the business part of it. Making sure we meet all the rules and regulations, which in healthcare with nursing homes there is an awful lot. Everybody kind of makes a joke that only nuclear power has more regulations than us. That's probably because of the time frame of when it was started in the 60s and developed with it. But the rules are good and stuff too. So also kind of over the healthcare part of it, there's a director of nursing that has the Department of Nursing that's kind of over her staff and making sure that the healthcare aspects of it are met too. But just making sure that we meet the financial and the rules and regulations.
Okay. So all right. Also, what should a senior look for when choosing a nursing facility, or the family of a senior, the husband, wife, or son, daughter of a senior? What should they look for in a nursing home facility?
Location, which everybody talks about real estate, it's obviously important also. Very important that you're going to have and feel comfortable visiting. So you want to be close. If you're having to drive to another town or across town and dealing with a lot of traffic, that's probably going to be a burden and a factor that keeps you from visiting, which is very important. Just because a person goes into a nursing home and is either short-term skilled rehab or is there for a long time, they shouldn't lose contact with family. So very important for that too. I would also recommend that you go to the facility and tour. Just walk through, and most facilities would be glad to do that, and a representative would walk through and answer questions and point out things that the facility offers. And as you're walking around, just come from common sense things as far as, do you smell odors? Certain times of the days and things are going on, but do you, throughout the facility? The next thing is, are the residents happy? Do you see the residents? Are they out, mingling and socializing, or are they in the rooms? And then I guess the next thing I would look to, are the staff happy? If they're happy and enjoying, and the company's taking care of them, and they're enjoying what they do, that's going to reflect in the type of performance they do and the job that they do and how they interact with residents, and then making their life more enjoyable and that social interaction.
Sure. I guess from when you walk in all the way through. I mean, and for full disclosure, I have an aunt that is at Peak Resources, and a few weeks ago had a big, a lot of my dad's side of the family over, and had a birthday party there in one of your back rooms for two of my aunts.
Right.
One came in from her house from another part of town, and then we had kind of a double birthday party there. And your staff was extremely welcoming and nice. And it's good to be able to do those types of things.
It is, and that's one of the just like when you're at home in the community. I mean, nobody wants to sit in their house. You want to get out, and you want to have people come into your house too. And I think most facilities that nowadays, they try and make a home-like environment. It's still kind of an institution just because of the way it's set up.
Sure.
But definitely, as far as even from the decoration part of it, but also to the social part of it, and being able to offer activities, which is a requirement. There should be an activity calendar that's posted in each resident's room. That's just kind of letting them know what's going on. And they should have a resident council. These are good questions as you're doing your tour to ask. They should do an individual interview with the resident and see what their likes and dislikes are for food and activities, so they can tailor a activity that they like to keep them involved and offer the other ones too. And that important part of the medication is that socialization too. I think love is one of the more important medicines that you can have.
Right. A positive outlook, love, the things that result from that, family, and a good positive environment is definitely a place to heal and recover, right?
Right, and as you're doing that tour, you're kind of looking for those kinds of things. Is it a cold feeling, or is it a nice warm fuzzy type feeling? I mean, that's always a good thing on there. facilities are required to have their 2567, which is their annual survey where the state comes in with nurses and pharmacists, a dietitian may
That's
come.
in North Carolina, correct?
In North Carolina.
Okay.
And actually all states are required. It's mandated.
Okay.
You could also have a federal survey, which is Medicare. Sometimes they're checking on the state surveyors to make sure that they're doing a job. You probably have about a 1 in 10 chances they're doing like 10% of those.
Mm-hmm.
So you won't see a federal survey every year, but you're guaranteed pretty much they're going to do the state survey, and they are looking at every possibility of all those rules and regulations.
Right.
They're making sure that the resident is getting the treatment that they need, which may be even to their personal funds, that they're not being taken advantage of from the facility. Their facility is required to offer that to them. It's an interest-bearing account that has a bond on it that covers the maximum amount that might be in that. Residents, they can't go back and forth to the bank, so it's kind of brought the bank to them.
Right. Okay. So they can have access to their money right there?
They're right there, they can. And most facilities, the shopping part of it too, a lot of facilities will offer shopping, on Fridays. We take everybody to Walmart,
Okay.
or go out shopping. Or if you don't feel like it, you kind of give a list to an employee that's managing the funds and stuff too, and would actually go and pick up personal items that they need.
Okay.
So most facilities offer that too.
Okay. How do you make sure you keep a positive environment, employees, just the overall, the warm and fuzzy feeling in your I don't want to call it a facility. What should I call it? Nursing home?
Yeah, and that's kind of got a bad name.
Yeah. So what can we call it?
Well, a lot of people have gotten to health and rehab because
Health and rehab. Okay.
People there for their health.
Sure.
And rehab has become
Health and
a
rehabilitation.
big item there.
Absolutely. And you guys have a rehabilitation
We do.
wing or part of?
Actually have a wing.
Because
dedicated to-
all nursing homes don't or aren't health and rehab facilities, right?
Right, and that's usually part of the Medicare benefits because most people, the elder people, have Medicare Part A or Part B or Part
Almost
C.
all seniors have Medicare, some form of Medicare.
They do, which is a good program. And that's going to cover, if they're coming in from the hospital, and right now there's a 3-day hospital stay that requires. With bundle payment, that is starting to change. But for most people right now, unless it's coming through a bundled payment part of Medicare, you're required to have that 3-day hospital stay, which that's been in the news quite a bit too, where people, you're in the hospital for 3 days, but they've had you as observation.
Right.
Which you think if I'm in the hospital and I've spent overnight, that's day one, and if that happens. But that is something good to check with the hospital as a family if they're, thinking, boy, this is going to look like it's going to go into even home health or going into a nursing home.
So look upon discharge from the hospital as to how they characterize the stay.
Exactly.
Okay.
And when you want it to be a stay and not a observation.
You want it to be a stay and not an observation because why?
That qualifies you to use your nursing home Medicare Part A benefits.
Okay.
Which will cover if you're meeting that criteria, which therapy would be a part, or wound care and dialysis, other what you think of skilled care for a resident, the more major type things. Trach
Is it 20 or 21 days?
20 days. It'll
20
cover
days.
100%.
100% for 20 days, and then if they have a supplement, is that right? So I don't know. I'm like taking a test. Yeah.
They do for it's 100 days. That first 20 is covered at 100%. The next 80 days, it's paying 80%. So there's a 20% copay.
The supplement would pay 80% if you have the supplement.
True.
At a 20% copay.
Right, which is a good thing to have because that can run up very quickly. That and if you're going to be there longer, or if you're not guaranteed those 100 days, that's if you're meeting the skilled level that Medicare says. And obviously, that criteria is part of the nursing home stay, but there's.
Let me ask you if this is true. I always say the way I understood it is if your prognosis is rehabilitation, you're going to improve. You are improving. Then you get to stay the full 100, even during the 80-day supplement period. But if at some point it changes to say, its prognosis is not going to be upward and get moving on, but is leveling off or even deteriorating, at that point, can the copay or can the supplement stop paying at that point, or will it?
That's pretty much right.
Okay.
And there's criteria set up by Medicare. The person the therapist would set up goals. I want them to be able to walk 10 feet in 5 days, and then
Sure.
at that 15 more. So if they're not increasing, like you said, and making progress, and there's a little bit of leeway there. If somebody's got other stuff going on and not feeling well, usually they say you can refuse 3 times, but after that, the therapy is going to be required to drop you, which is going to drop your Medicare aid benefits and the supplement also.
Right.
Unless you have like a long-term care insurance policy. In our field, we'd love to see that because it takes a lot of burden off people and stress as far as, you've got all this medical and new environment going on, and now you're worried about a different bill and what's paid and what's not covered paid, and it can get very expensive quickly. So when people come in with that supplemental long-term care insurance, you can tell they planned ahead, and that's usually a lot of burden off of them, a lot of stress, and they can concentrate more on getting better and kind of adapting to the new environment. So if that Medicare or the supplement part of it quit kicking in, if you have that long-term care insurance, that usually
would pick up and pay.
Okay. So
or ways to pay. We've gotten into ways to pay. Obviously, private pay would be a way to pay for nursing home or any other type, health and rehab or assisted living. Any private pay is always good.
It is. We don't mind those people either.
No. But in a pinch, I understand Pete does take some Medicaid patients as well.
We do, and I'd say almost all nursing homes do. I'd probably say 95% do.
Okay.
And some of them may, whether the beds are certified. Say if it was a 100-bed facility, maybe only 50 of the beds are certified, or 80% of the beds are certified.
Sure.
And that could also be with the Part A too. You can have them duly certified, where they're both Medicare and Medicaid certified, or one of each.
Okay.
And of course, if you have Medicare and you're not in that certified bed, Medicare is not going to pay.
Right.
So obviously, the home would probably advise you of that before you went into it too.
So, do you meet with families from time to time? I know people in your you have other folks that are there that are trained to meet with families to, I guess, make sure they have their affairs in order and are ready to can find a way to pay for the services and help qualify them and help them through that process. Is that right? Almost like a social worker or a social worker maybe.
Right.
Yeah.
Required. One of the federal regulations is you have to have a social worker, and the degree's met on that too. And with that, they do set up, systems as far as, and of course, obviously a business manager which takes care of the billing. But with the social worker, you're correct on that. As far as community resources, there are options there too, as far as to help pay or to help set up other support systems.
Just to help the family figure out, hey, this is how we're going to do this.
Right. And most families, this is their first time going through it. Their parents or whatever have aged, and it's that time, and they've gone through something that they're needing it. So for most people, it is kind of a new system that they're getting into and unfamiliar with. A lot of questions.
It can be very complicated.
Very complicated, going back to all those rules and regulations, and if you meet the criteria, you do qualify, but you left out one thing and you don't, and that could get very expensive.
Right. And do you find that most families have planned ahead for this type of situation?
No.
Okay.
And that's kind of, I think people just...
that's a loaded question.
It is. Yeah. People want to put that off and think it's not going to be me.
Right.
If you look at statistics, you've got 1 in 3 chances in your life in being in a skilled nursing facility.
Skilled nursing. You have a 70% chance of needing some type of long-term care right now if you're 65.
And of course, a lot of that has changed now. We do have, probably 20 to 22% of our residents that are short-term that may come for that Medicare Part A. They get the rehabilitation, and they're able to go back home or go back to living with a family or some type of support system with home health agency or a sitter or something.
Adult daycare, life enrichment, something. There's a lot of different options out there.
A lot of good supports out there.
There are, but nothing yet. I talk about alternatives to nursing home care sometimes. We talk about in-home care or life enrichment. But really, when you need nursing home care, you need nursing home care. Isn't that right? I mean,
That
there's
is
no
true.
real replacement.
And, you know, as our society is,
Yes.
is spread out in the
Right.
community, you know, have family and they're spread out in a different state or a different community and hard to take care of. So those are, but true. I mean, it really isn't. Sometimes that we do see the difficult part of that. You know, the family member needs skilled care. They, of course, prefer to be home. Would rather be home, and family just cannot, you know, quit a job and stay with them 24 hours
Right.
a day. Especially as you see Alzheimer's disease and dementia coming in.
Which increases just all the time.
It does higher
The
demand.
diagnosis. Yeah.
And the person may seem high functioning, be able to do stuff for them too, but you know, just that mental capacity to, you know, a lot of times the doctor's looking at, do they have the mental capacity and the physical capacity if the house is on fire to get out?
Right.
So, and that's not a safe environment.
Right. And at some point, you know, not just the doctor, but social services would get involved if, you know,
Unsafe
and
environment.
say, look, you know, this is not a safe environment for this senior to live. Right? Yeah, something that has to be done. And if you don't do it and find a suitable place for that senior to be cared for, then they're going to do it. They're going to step in and take over as guardians for mom or dad, and they're going to put that person somewhere suitable.
And we're obligated, again,
Yeah.
by rules and regulations there, that if we think it's somebody, you know, it's their right to go home and they're going to try and want to, but if we, social worker or the doctor, feels like it's going to be an unsafe discharge, we're required to notify Adult Protective Services, APS, and they would come in and they would do a home assessment and make sure it is safe and that if somebody needs to be there and the person's going to be able to get their medications and take it, they're going to check that environment out and make sure. And if not, they're going to step in, like you said.
And that's not meant to be a big brother type of thing. That's meant to be a safeguard in the system to help seniors. And to help seniors to keep from having them be taken advantage of and make sure they get adequate care and are you know, their needs are met, essentially, right?
That's true. And a lot of people think of that as, you know, more of, you know, somebody's taking advantage of them financially or something there too. But they do look at the health aspect of it too. It's probably more so what they're looking at there. And there is some, you know, advantages and people taking advantage of them from the financial part of it.
I mean, I've seen the health issues before where, you know, perhaps someone has dementia or Alzheimer's and the family just either refuses to admit what's really going on or it just doesn't have the time to devote to it. And, you know, all of a sudden mom's walking 2 miles up the road one day and
the neighbor's calling.
Yeah, that's right. Yeah, the neighbor's calling 911, the cops are there. Yeah.
And we get residents from that. That's, unfortunately, they've, you know, have gotten out a lot of times at night or whatever too, and a neighbor has called and they've, from literally laying in a ditch beside the road, had fallen down and can't get up, and I mean, have laid there for hours. So I mean, we do have residents coming from that.
Yeah. So, well, thank you for sitting down and talking with me about what we call nursing home care, but we're now going to try to transition that to health and rehabilitation, okay? Because it's just so much more than what comes to mind when people think of nursing home care. Appreciate all that you do at Peak Resources and the community and your expertise, okay?
You're welcome.
You got any questions for me? Are we good?
I don't know.
You ready to go eat?
I'm ready.
All right, let's go. All right, thanks, Kris.
You're welcome.
Okay.